Hi, I'm Dr. Jovitamartindaniel. I'm here to talk about HPV virus, what it causes, and what are the ways to prevent it. Let's see what HPV virus is. HPV virus is human papilloma virus. It's a very contagious sexually transmitted virus. Now, it has two strains. One is a low virulence strain and the high virulence strains. Low virulence strains can cause warts, and high virulence strains will cause cancer. What are the main symptoms? Now, we see that in low virulence strains, there can be warts which can happen in the genital region, like a cauliflower like wart or a flat wart, or it can happen in the ungual, periungual, ungual areas, and in the feet, in the plantar regions. So, some patients do manifest with HPV virus infection. Some people don't manifest with HPV virus. Um, Therefore, it is not really possible to know who is the person who actually has the infection, and only those with the warts have an infection. Those without the warts don't have an infection, cannot be actually said. Now, is there a cure for HPV virus? Actually, no. So, once a patient is infected, when they are healthy, their own immunity will be able to flush it out and clear the HPV virus from their system. But there are times when they are not able to clear completely, and that's when it will manifest itself later on after few years through different forms of cancers. Now, what are the cancers it can cause? For both men and women, throat cancers in the form of oropharyngeal cancers and anal canal cancers are common. For men, especially penile cancers, and for women, vagina, vulva, and cervix cancers. Since cervix is pretty deep-seated and it is the patient herself cannot examine, it is right that screening should be done by a professional. Otherwise, we may miss the cancer in an early stage, and the patient might progress and come to us at an advanced stage. So, does it mean that anyone who has HPV virus will definitely manifest with cancer? It is not so. At the same time, we have to understand that 80% of people who are sexually active at some point in time do contract this infection, and their system automatically clears off the infection. But those ones with poor immunity, those ones who have a polygamous relationship or a sexual promiscuity, will manifest with high virulence strains and therefore eventually develop cancers of different forms. Now, who are the people who are at a very high risk? Those people who have been married off early, like in the yesteryears, we used to give the girls used to be given in for marriage at a very early age of around 11 and 12. So that's when the cervix cancer rate was very, very high. But as of now, this trend has changed, and this has averted the cancer rates in cervix to a large extent, and also thanks to the vaccination and the surveillance programs. What we see is that early sexual exposure is one of the reasons, and the next being lack of vaccination and lack of surveillance can increase the risk for cancers. Immunocompromised people who have HIV, tuberculosis, transplants, those also can contract the infection. And the most important risk group will be gay, bisexual, and heterosexual men who have multiple partners, women who have sex with women, and women who have sex with men and multiple partners. These are the groups of people who are extremely vulnerable for this particular virus and the cause for several cancers attributed to this particular virus. So, what is the way to prevent it? It is by vaccination, screening, and also by fidelity in monogamous relationship rather than a polygamous relationship. Let's look into the vaccination point of view. Now, we have Cervarix vaccine, which was developed in 2006, which covers two different strains of HPV virus, which is 16 and 18. It costs around 2,000 and its effect is for about 10 years or so. The next is Gardasil vaccine, which was which was used since 2009, and it covers 4 strains, the low virulence strains, which is 6 and 11, which causes warts, and the high virulence strains, which are 16 and 18, which causes cancers. So 4 different strains are being covered by Gardasil, and the cost of this particular vaccine is around 4,000 rupees. Now we have the Gardasil 9, which was developed in 2017, which covers 9 different strains, the 6, 11, 16, 18, 45, 52, 58, 31 and 33. This particular vaccine, Gardasil 9, costs around 9,000 to 10,000 Indian rupees, and we could be using this vaccine until the age of 45. Now let's look at the vaccination schedules. Who are the people who need to be vaccinated? From the age of 9 to 14, 2 doses of vaccination should be given. If the vaccination is given today as a 0th day, then the next dose will be 1 month later. Person crosses 15 years until 45 years, 3 doses of vaccine can be given. If today is considered as day 0 and the first dose is given, the second dose will be 1 month later, and the third dose will be either at 6 months or 12 months. The next question would be, why would we even want to vaccinate young girls and boys when they're not even sexually active? Now, this is a very, very pertinent question, and the answer to this is, unfortunately, we do see that at this point there is an increased rate in the abuses of children, both girls and boys, in the forms of molestations and unwanted sexual interactions. Therefore, in order to prevent any kind of HPV infections in young girls and boys, it is extremely important for parents to make a decision to vaccinate the children between the age of 9 to 14. And even if the children are more than 15 and more than 15, when they are young adults, or even if they have missed out on a vaccination until the age of 45, now Gardasil 9 can be very well administered to the people who are requiring it. Until the age of 45, people can be given the vaccination, both men as well as women. Why is it that men should be administered this vaccination? That is because men are the main carriers for HPV virus. If someone loves the wife, a responsible male who would like to take care of his spouse, his wife, will get vaccinated. That is number 1. The next important reason is that even men have a risk of human papillomavirus induced cancers in the form of throat cancers, anal cancers and penile cancers, which is going to reduce by 90% or more, and eradicating the HPV virus by these vaccinations. I think that we should urge young men to be vaccinated with this HPV virus vaccination. The Indian Association of Research in Cancer and WHO have collaborated, and they have named January for the awareness month for cervix cancer. Now, they have also come up with a very important strategy in order to eradicate HPV virus and abolish cancer cervix in 2100, which is 75 years from now. So, with an effort to do that, they have come up with this 90-70-90 rule. 90% of the young girls between the age of 9 to 14 must be vaccinated with HPV virus. And I would say even the boys should be vaccinated. And 70% in that 90-70-90 rule says that 70% of the women should be offered the high performance HPV DNA virus testing. And then the next 90 is 90% of the women who have precancerous lesions or who have cancer should be offered treatment. Now, as an extension of help to the Indian IARC and the WHO, I think as every human being, as every man and woman, we must get the HPV vaccination in order to eradicate the cancers in these sites in throat, anus, as well as the penile cancers in the males and the cervix, vaginal and cervix. So as an extension of help that can be offered to the Indian Association of Research in Cancer and the WHO, I think every one of us must take an effort in order to vaccinate ourselves and vaccinate our children, especially when we are less than 45 years. But there will be another question that there are a lot of people who have not yet been vaccinated. So, what is the way to help them out? Now, those people, um, when we vaccinate the children between the age of 9 to 14, there is 90% reduction in the risk of these cancers and elimination of HPV virus. When we do a proper screening protocol, even without vaccination, from the time a person is sexually active until 65 years, that also reduces the risk of cancer development. Now, how do we do that? Those women who become sexually active, from the time they become active, they have to do a PAP smear every 3 years and HPV DNA testing once in every 5 years up to the age of 65 years. So this also can avert HPV virus and development of cancer. So the best way of preventing HPV virus and the cervix cancer and the other cancers such as throat, anal canal, penile cancers, vaginal and vulval cancers would be number 1 by vaccination, number 2 by screening, and number 3 by living a life with moral values and fidelity, adhering to a monogamous relationship and never venturing into polygamous relationship. So what are the symptoms of cancer cervix? Cancer cervix can present in the form of vaginal discharge, bleeding or intermenstrual bleeding, pain during intercourse, dyspareunia, which is called as pain during intercourse, which is called as dyspareunia, and we have there could be bleeding after intercourse. There could be some pelvic pressure or pain during intercourse. And in a later stage, the patients can develop symptoms such as difficulty in passing urine, a swelling in the lower limbs, and based on where the cancer has spread, if it is to the brain, there can be symptoms such as headache and increased intracranial pressure. There can be symptoms such as jaundice when liver is involved, and cough when there is lung that is involved, and shortness of breath can also happen with lung involvement. Now, the treatment is based upon the stages. In early stages, until stage 1B, the patient can be cured either with radiation or surgery. Once it crosses stage 1B, 2, then I think the best way to go would be with chemoradiation until it is locally advanced. Once it becomes metastatic, that is stage 4, then the way to go will be chemotherapy and immunotherapy, and maybe with radiation whenever required. When it's a very, very early lesion in cervix, there is possibility of doing laser electric loop excision or cryosurgery or laser therapy or conization and trachelectomy. So after trachelectomy also, there has been instances where people have delivered children, and in those cases we will have to have a cervical encerclage to make sure that the birth of the child doesn't happen quickly. In 2022, there were 6.5 lakh new cases of cancer cervix globally, and 3.5 lakh cases of cervix cancer patients expired because of this particular cancer. And we also see we have also seen some celebrities who have lost their lives and succumbed to this disease. Like we have Dolly Sohi from India, and we also have Jade Goody, a UK-based TV actor who expired by the age of 27. It is extremely important for all of us to understand that eradication of this virus is crucial to avert several cancers in the future. Hope this information is useful. Thank you.